Regina Edibe from Captain TV. Please may I know you?
Good morning. My name is Dr. Chigozie Orisakwe. I work for AHF as a site coordinator of the Abuja Clinic.
So, while we're talking about hepatitis B,
Okay.
I really want you to tell us more about hepatitis B. Generally, what hepatitis B is.
Okay. Hepatitis B is not a strange word in Nigeria right now. It's something that is very popular down to primary school. Down to kids now. It's a life-threatening disease that is caused by hepatitis B virus, and it has affected about 257 million people globally. So the burden is so much globally right now, and unfortunately, Nigeria, which falls in sub-Saharan Africa, happens to be one of the places or the areas with the largest burden. Hepatitis B, like other hepatitis, like the C, the A, and all that, is more life-threatening than some other ones because it affects the blood, and that's also the mode of transmission. It affects the whole body. It's transmitted through the blood and some body fluid, and it affects the whole body. It shuts down the liver. It has the capacity to do that, to cause liver cirrhosis as well as liver cancer, hepatocellular carcinoma. So that's why it's really a life-threatening condition. Yeah.
Hepatitis B, is it treated?
Well, hepatitis B it's currently treatable. You can treat the symptoms, but it's not curable. There's no specific medication you could take now to say you're going to cure hepatitis B, but you could treat symptoms that people present with. You could decrease the progression of the disease using medications. Do you understand? So that way you can still prolong the life of the person. You can prevent the disease from progressing from the acute phase to the chronic phase and to causing damage to the liver. So we could say that it's treatable. Do you understand me? You could say it's treatable, but it's not. There's no medication to say that you can take right now and it cures it completely.
How do people who have hepatitis B stop hepatitis B from spreading to other people?
Okay, so like we know, it's just all about awareness. It's still trying to create awareness, trying to teach people about this disease as a global body. It's an epidemic. Its burden is so much in Africa. Do you understand? Africa is one of the largest places that have up to 68% of hepatitis B infestation. So it's still about education. You need to educate people on the mode of transmission. And how do you do this? You go to schools, you go to universities, you in youth forums, on television, media sources. You could use them to educate people that these are the modes of hepatitis B transmission. It's similar to HIV transmission, mostly through blood and body fluid. So we have the vertical transmission, which you get from mother to child. Then you also have the horizontal, which you could get from one person to the other. So you could get hepatitis from sharing sharp needles. You could get, that's for drug users. You could get hepatitis from blood contact, unprotected sexual intercourse, blood contact of any sort. Do you understand? You could get hepatitis B. But interestingly, hepatitis B virus could live longer than you can imagine outside the body. You drop a blood of hepatitis B on this table, it can stay here for another 1 week, another 7 days. And if you come in with an open skin, it could infect you. Do you understand? So it's very infectious. So how to curtail this is by educating people, letting people know that this disease is highly infectious. Do you understand? That you should know the mode of transmissions and the means through which you can get them and avoid them so that you cannot transmit this disease to another. And most of all, and very interestingly, it's preventable. it's quite preventable. You can be vaccinated and have a life-free hepatitis. Do you understand? So educating people, letting them know that there are vaccinations which are very affordable that they can have that will cover them. Even newborn babies too can be vaccinated as well, so that you can protect them from having hepatitis B. So with this education, people can live a life free from hepatitis B. Do you understand? Yes.
Thank you very much. Well, before we go, I just want you to throw more light on the vaccines.
Okay, yeah, so like I said, a lot of outreaches and programs that are conducted by certain individuals now incorporate hepatitis B testing and vaccination in their program. For instance, you see some outreaches going on here and there. You see hepatitis B outreach and all that. These are just to create awareness and to make people know that there are vaccines. In fact, the vaccines have been available since 1982, but a lot of people never knew about it. So it's just to let people know that there are vaccines for preventing hepatitis B infection. Do you understand? And these vaccines are taken at 3 almost consecutive times. You understand? 0, 3 months and within 6 months. Do you understand? You can take these vaccines and it will prevent you for the next 10 years from getting hepatitis B infections. So you could probably go to centers where they give vaccine, centers where maybe primary health center, local governments where they vaccinate people, even Ministry of Health, to get these hepatitis B vaccines, and they are not expensive, they are really affordable. But before getting the vaccinations, every facility will require that you test to be sure that you do not have the infection already before being vaccinated. And it might also interest you to know that somebody who has already acquired hepatitis B before and is having a dormant disease do not need vaccination. Do you understand? The person do not need, because the disease itself has a way of making you immune to it after you've gone through through the acute phase. So you become immune to it. So you do not need to be vaccinated again. But for those who have never had any episode of the illness, have never been infected, should try to get vaccinated from hepatitis B.
Thank you very much, ma'am.
You're welcome.
It's really nice speaking with you.
Thank you so much. Thank you.